problem with continuously high blood pressure is that it can affect the organs that are directly perfused from those arteries. And usually we think about the heart, the kidneys, the brain, and the eyes, and the peripheral vasculature that can get some of that damage. And perhaps, Gianfranco could comment on the risks, particularly related to stroke, heart attacks, and kidney disease.
It's very important to understand what happens if blood pressure is too high. A high pressure implies more work for the heart, but also implies a damage on the walls of the arteries. There is a stress on the wall every time there is a wave of blood pressure coming, if this is elevated. So the heart, over the years, can undergo several types of problems. First of all, the pump itself might be damaged, and in the long run, it might become weaker. And this is leading to heart failure, where the heart is no longer able to push the blood into the circulation and to guarantee a perfusion of the organs. And that's a very dangerous complication. But you may also damage the arteries, the arterial walls, including the arteries who are bringing blood and oxygen to the heart itself, the coronary arteries. Also, in this case, you might see a damage in these arteries, which are crucial to feed the heart, and then you might undergo ischemia or myocardial infarction, where the heart can have a damage to its own cells, and some of the pieces of the wall might die, which may be very risky for the patient. A similar phenomenon happens in the brain. The brain is essentially depending on circulation for its function. If you have a too high blood pressure, this is damaging the arteries, carrying the blood into the brain circulation, and you might have two types of problems. You have an ischemic stroke, where the plaques, the damage occurring on the arterial wall might lead to an occlusion of one of these vessels, so some part of the brain do not receive blood any longer. The other problem, which is related but different, is when a given blood vessel might break down due to a high pressure, and you might have a hemorrhagic stroke, which is also damaging very seriously the brain.